What is hand, foot, and mouth disease? It is a viral infection caused by a Coxsackie virus which is common in young children. The condition is usually mild and characterized by mouth sores and a rash on the hands and feet, hence its name. What causes this disease? Oral ingestion causes hand, foot, and mouth disease. The illness can also be spread by person-to-person contact with droplets sprayed into the air after a cough or sneeze, nasal secretions or throat discharge, saliva, fluid from blisters, stool. What are the symptoms? Hand, foot, and mouth disease may cause fever, sore throat, painful, red, blister-like lesions on the tongue, gums, and inside of the cheeks, a red rash, without itching but sometimes with blistering, on the palms, soles, and/or on the buttocks. Irritability in infants and toddlers, and loss of appetite may be added symptoms. The usual period from initial infection to the onset of signs and symptoms, incubation period, is 3 to 6 days. A fever is often the first sign, followed by a sore throat, and sometimes a poor appetite and feeling unwell. 1 or 2 days after the fever begins, painful sores may develop in the front of the mouth or throat. A rash on the hands and feet and possibly on the buttocks can follow within 1 or 2 days. Your child should see a doctor if mouth sores or a sore throat keep him or her from drinking fluids. Symptoms that worsen after a few days should also be reported to your doctor. Who are at risk to get this disease? It primarily affects children younger than age 10, often those under 5 years. Children in child care centers are especially susceptible to outbreaks of hand, foot, and mouth disease. How can you prevent your child getting it? Certain precautions can help to reduce the risk of infection with hand, foot, and mouth disease are: wash hands frequently and thoroughly, especially after using the toilet or changing a diaper. Disinfect all common areas, including shared items such as toys, as the virus can live on these objects for days. Clean your baby's pacifiers often. Teach good hygiene. What is the treatment? There's no specific treatment for hand, foot, and mouth disease. Signs and symptoms usually clear up in 7 to 10 days. It may be soothing to swish with warm salt water if the child can rinse without swallowing. A topical oral anesthetic may help relieve the pain of mouth sores. Over-the-counter pain medications other than aspirin may help relieve general discomfort. Some tips to help make blister soreness less bothersome and eating and drinking more tolerable are: suck on ice pops or ice chips. Take cold foods or drinks. Avoid salty, spicy, and citric foods. Eat soft foods that don't require much chewing. Thank you for watching, and please subscribe or follow for more videos.